Yeah, there are a lot of mixed feelings about children being back in school. We have heard a lot of stories of increased numbers of hospitalizations for children. Thankfully, here at Community Hospital, we have not seen a large influx of severely ill children with COVID. It is certainly possible, but has not yet materialized. But we do need to be vigilant in monitoring our children for symptoms and vaccinate as many people around the children as possible. Yeah, unfortunately, as we head into cold and flu season, some of the symptoms of COVID in children can be pretty mild and easy to dismiss. So children may just appear like they have a simple cold with a runny nose. It could be just a sore stomach, or it could even be a headache. They may not have the more traditional symptoms like a high fever or a cough. So any new symptom in your child should be taken seriously, and you should have them evaluated and tested for COVID-19 before sending them to school or another public setting. Yeah, it's a tough decision for many parents to decide whether or not they feel comfortable sending their children to school, particularly those who are under 12 years of old and not yet able to be vaccinated. I have two children that fall into that group myself, and they are back in person in school. And I know that all of the school districts have very solid plans to really decrease the risk of getting COVID in the classroom or on the school campus. So if you have any questions or concerns, you can ask your local school board or your local superintendent or even the children's teacher about what their plans are to decrease the risk. I know now kids in California can spend a lot of time outside, which further decreases the risk. But again, this is something each family has to decide on their own. But being in person has a lot of benefits too. Yes, unfortunately, we still have pretty widespread transmission of COVID in the community, and we are seeing cases in the school-aged children which will require their classmates, in many cases, to be sent home and monitored for symptoms. Now, there are a few ways that you can monitor yourself. It can just be by checking for symptoms, or it can also be by surveillance testing. Many, if not all of the school districts have options for that surveillance testing, even in the absence of any symptoms. So if you have immune-compromised or other vulnerable people in your household, it might make a lot of sense to participate in that surveillance testing, even in the absence of symptoms. But in the vast majority of cases, there will be some sort of symptom present, and if that does happen, you should seek testing immediately. Yeah, there are also, aside from the testing options available at the schools themselves, options to buy COVID tests that you can do at home. And as long as you're buying one that has the FDA's authorization and following the instructions precisely, these are reliable tests and could be another option to give you some added reassurance before heading out the door to school.